To the growth factors. So every cell produces growth factors. Most of your growth factors, they come from your blood, right? What's in the blood? You have cells in the blood, right? You have lymphocytes, you have neutrophils, you have different types of other cells, red blood cells, and so on. All of them produce growth factors. Your endothelium of your blood vessels produces growth factors, and these growth factors, they are responsible for the well-being of your organs, for the well-being of your of the cells of the body. So you have all these different. There are so many growth factors. We can't name them all. There are so many, but here are some of the important growth factors that you will come across, and familiarize yourself with these names, because we will keep repeating these names all the time. Like TGF. What does TGF mean? Transforming growth factor. It's one of the common ones. VEGF is one of the common growth factors that we talk about. This is the vasculoendothelial growth factor. VEGF is mostly about growth of blood vessels and neovascularization. So when you have inflammation, what happens in inflammation? Your blood vessels get damaged, right? And then they need to be repaired and new vessels need to be formed. So there comes this VEGF, which is your vasculoendothelial growth factor. Then you have your fibroblast growth factor. What does the fibroblast growth factor do? Formation of ECM, right? It's to do with fibroblasts. What about platelet-derived growth factors? They increase in the formation of platelets. Then you have your hepatocyte growth factors. What does this do? Formation of hepatocytes in the liver. So every organ has its own growth factors, and these growth factors help in the development of the organ. So have a look at this table. I like tables because it's easier to study. It talks about the growth factors, talks about their sources, right? So if you look at sources, you'll be able to see whether they come from the blood or whether they come from within the cells of the organs. So mesenchymal origin or blood origin or ECM origin. It all talks about sources of these growth factors. And then function of the growth factors. Mostly function remains the same. It's the growth of organs, growth of cells in the organs and blood vessels and so on. Now a few words about extracellular matrix. Extracellular matrix is produced by cells. Mostly it's collagen fibers. And then how many types of collagen fiber do you have? I think there's about 18 or 20 types of collagen fibers, depending on which organ the collagen fiber is in. So different types of collagen fibers. Then you have fibronectin proteins. You have integrin proteins, which basically bind the ECM to the cells of the organ, because the organ is fixed to the ECM, and usually it's fixed by integrin proteins. So that's basically the architecture of your extracellular matrix in relation to the cells of an organ. Yes?
Where is the ECM?
Oh, the ECM? Everything around the cell is your ECM. Your organs are held in their place by extracellular matrix, right? Extracellular matrix are mostly collagen fibers and your other structural proteins that basically provide the architecture in which the organ is placed.
So everything is extra.
Yes. So the organ and its cells, these would be your functioning unit, and the extracellular matrix would hold the organ in its place, and the blood vessels and everything else. Now again, different interactions between the cells and the extracellular matrix. So you can see different types of collagen. This is the basement membrane, which interacts with the extracellular matrix. So the basement membrane has collagen, laminin, proteoglycans, and this is what it looks like. Then you have your interstitial matrix. The matrix itself, it's made up of fibroblasts, and then it has fibrillar collagens, elastin, proteoglycans, and hyaluronol. And then you have linkages between these so that they can be, they can form the structure of your organ. So remember, it's mostly collagen. Along with collagen, you have different types of other proteins like laminin, you have proteoglycans, elastin, and so on. And all these fibers will hold organs together and make sure they are in their place. And finally, we have cell division. Cell division has 4 phases, right? What are the 4 phases? G1, S, G2, and M phase. And the cell divides after these 4 stages, or 4 phases, or 4 cycles of cell division. Now you have proteins which are required for these cell cycles. They are called cyclins. And then you have CDK, which are your cyclin-dependent kinases, which actually produce these cyclins, which are the proteins required for cell division. So basically, cyclin-dependent kinases are responsible for cell division because they produce these cyclins which are responsible for cell division. So you have all kinds of CDK inhibitors which can inhibit division of cells. So you have all these inhibitors for each cyclin. So cyclin D is basically required for the G1 phase, and this basically is produced by CDK4, and then you have CDK4 inhibitors, and these are the CDK4 inhibitors. Then you have CDK6 inhibitors, which is for the S phase, and so on. So you can have a look at these different cyclin-dependent kinases and how they are inhibited. So these inhibitors basically check cell division and make sure that cells do not multiply randomly. Now we talk about cellular adaptation, we talk about cell injury, and we talk about cell death. Now the aim, objectives of this discussion, number 1 would be to understand the 3 anatomic concepts of disease. There can be 3 outcomes of disease. You can have disease which is a degenerative disease. What is a degenerative disease? In which the cells of an organ will die. You can have an inflammatory disease. What's an inflammatory disease? Where inflammatory cells will, invade an organ or cells, and they produce all kinds of reactions which are called inflammation. Or you could have neoplastic disease. What is neoplastic disease? Where the cells of an organ will start proliferating, and these new cells will be non-functional, and they will interfere with the working of an organ. These cells will proliferate fast, they will avoid apoptosis, and they will use all the resources of the organ. They will have neovascularization, they will start producing VEGF, they start producing TGF, and they start growing even more. So one of the hallmarks of a tumor, what's the hallmark of a tumor? How do you recognize a tumor just by looking at it? It will have a very rich blood supply. That's the only way a tumor can survive, right? To have a very rich blood supply, because the way it grows, it's much, much faster than your regular cells of an organ. So it needs more oxygen, it needs more resources. So it produces a lot of VEGF, it produces a lot of growth factors so that it can enhance its blood supply. So 3 basic concepts of disease. You have degenerative disease, where cells die. You have inflammatory disease, where inflammatory cells will invade an organ and will bring in all the mediators of inflammation. And so you will have increased permeability, you will have bradykinin, you have histamine, you have complement activation, you have activation of platelets, and then you have, what else is there? Arachidonic acid metabolites are produced, and then you have coagulation factors, they get activated, and so on. So the process of inflammation is also part of the disease process, and so you have inflammatory disease. And the third one is neoplastic disease, where cells just proliferate and take up the resources of the organ. Now, understanding the factors of cell injury and death. So the first thing is oxygen, right? Why would a cell die? The first thing is lack of oxygen. So oxygen is the basis of life, and without oxygen, a cell will get injured and it will die. What's the first thing that happens when you have lack of oxygen? So, yep, that's what is causing lack of oxygen, right? Inside a cell, what's the first thing that happens when a cell lacks oxygen? Oxygen is required by the mitochondria, right, to produce energy. So when there's no oxygen, what will happen? Mitochondria stops producing energy. What's the first thing that happens when there's no energy? The sodium-potassium pump fails. And what happens then? Sodium moves in, potassium moves out, and the cell cannot survive anymore. Calcium pump fails. Calcium starts to move in. And so calcium accumulation in the cell will cause further injury. All the functions of the cell are energy dependent. The mitochondria itself will start swelling up and start producing free radicals. And now these free radicals will start damaging more organelles. So oxygen is the key when it comes to cell injury. If there's no oxygen, the cell gets injured and it will die. Chemical and physical factors will also damage cells, right? Any kind of chemical factors, any chemical compound which the cell does not like, it will disrupt the cell membrane and it can damage a cell. Physical factors like trauma or occlusion of a blood vessel, right? What will that do? When a blood vessel is occluded, there's no oxygen to the cells and cells get damaged. And then infection, toxins, another reason for cell damage, right? You have an invading organism will attack the DNA, incorporate itself into the DNA, start producing random proteins, right? The cell is not functioning well, it gets injured and it can die. Immunological damage, your immune system, right? Every cell has receptors. Every cell of your body has receptors on it, and these receptors are recognized as self-receptors by your immune cells. What are your immune cells? Main immune cells are T and B lymphocytes, right? Every T and B lymphocyte has memory. It knows self-antigens from foreign antigens. Every cell of your body has receptors on it which are recognized as self-receptors or self-antigens. So your immune system does not attack them. So something goes wrong with your immune system, and now these self-antigens are considered as foreign antigens. And what will the immune system do? It will start attacking your own cells. And so causing immunological damage to the organs and to the cells. Genetic mutations. Genetic mutations can produce cells that don't have self-antigens. And so they become target to your immune system. Nutrition is by far one of the most important things. If you don't eat right, you will injure your cells and you will kill your cells. So nutritional abuse is another factor that injures cells. So all these are factors that cause injury to the cells, and they can cause cell death. Now, different types of cell deaths. What's the difference between apoptosis and necrosis? Apoptosis is programmed death, right? Every cell is programmed to die. When a cell is formed, it already has information on when it's going to die. So apoptosis is natural programmed death of a cell, whereas necrosis is untimely death of a cell. So a cell is functioning well and something injures it and it goes into irreversible injury that leads to death of the cell. So that is necrosis. More objectives. Now understanding how at a subcellular level what happens to a cell when it's injured. So what happens to the mitochondria? What happens to ATP production? What happens to calcium? calcium, the pumps fail and the calcium starts moving in, it accumulates in the cells and kills the cells. Free radical formation. You have oxygen free radicals, you have nitrogen free radicals, you have all kinds of hydrogen peroxide. This is also free radicals. So instead of calling them ROS or oxygen radicals, you call them free radicals. And then cell membrane gets disrupted. Organelles, they have their own membranes. These membranes also become disrupted. If an organelle is exposed outside the cell, it does not have the self-antigens. And so your immune system will engulf and destroy these organelles. So all kinds of stuff happens at the subcellular level that will cause damage to the cells. Now what happens at the subcellular level in response to injury? Lysosomes become active, right? They will try to engulf all the toxins, they will phagocytose all the bacteria, all the stuff which is causing the damage and try to reverse the injury. Your smooth endoplasmic reticulum, if the injury is related to a bacteria getting inside the cell, goes to the nucleus, starts producing unnecessary proteins. These proteins might not get folded properly because your endoplasmic reticulum doesn't know what to do with these proteins. So what's going to happen? Accumulation of proteins within the cells, and they can cause endoplasmic reticulum stress and the endoplasm and can cause cell injury and death. And finally, we'll talk about cellular adaptations. We'll talk about what is hyperplasia, what is hypertrophy, what is atrophy, what is metaplasia, what is dysplasia, and so on. We'll also talk about intracellular accumulations, how when the cells get old, old cells have stuff accumulated inside them. So you can have accumulation of calcium, you can have accumulation of fat. What's fat accumulation called? And where does it accumulate most commonly? Liver, right? What do you call a liver which has fat in the cells? A fatty liver, right? So fatty liver is fat accumulation in the cell. Calcium can accumulate in the cell. Hyaline, these are clear crystal-like compounds which accumulate inside the cells. Mostly in, where does hyaline accumulate? Mostly in cartilage, bone, and so on. Proteins can accumulate in the cells. Glycogen can accumulate in the cells. Pigments, tattoos, these are permanent accumulations inside your cells. Now, when a cell gets injured, there are two ways, there are two paths now. Either the cell will recover or it will die. So, when you have a reversible abuse to the cell, it's called injury because cell gets injured, it gets better. Otherwise, if it's an irreversible abuse or something that causes an injury from which the cell cannot recover, the cell will die. Now, you can have apoptosis, which is the natural or normal death of a cell, or you can have necrosis, which is an untimely premature death of a cell. Now, these are the differences between apoptosis and necrosis. So you can see, I think we have a table which will explain more. So if you look at this table, it tells you the differences between a cell that is going through apoptosis or a cell which is going under necrosis. So if you look at the cell size, in a necrotic cell, the cell will be swollen up. In an apoptotic cell, you would have shrinkage of the cell. The nucleus, you will see pycnosis. What does pycnosis mean? Pycnosis is shrinking cell with a large nucleus. What is karyorrhexis? Karyorrhexis is when the nucleus divides into fragments. And karyolysis means the whole nucleus gets, lysed or gets degraded. And so this is the last stage where the cell will die. In apoptosis, you have fragmentation. mostly it's fragmentation of the nucleosomes. You do see some karyorrhexis because the nucleus will divide into segments, but mostly it's going to be fragmentation into nucleosomes. Plasma membrane in necrosis will be disrupted. In apoptosis, it will be intact, but you will see some bleb formation on the plasma membrane. Now, cellular contents, there will be enzymatic digestion and they will be leaking out of the cell. In apoptosis, the cell membrane is intact and you have intact cellular contents. Now, they may be released from the cells in little packets which are called apoptotic bodies. Usually in necrosis, there is adjacent inflammation, whereas in apoptosis, there's no inflammation around the cells. Right? Necrosis is caused by inflammation. So you will see inflammation around around necrotic cells, whereas cells that undergo apoptosis, this is natural death, so there might not be any inflammation around it. And what's the physiological or pathological role of necrosis? It's basically destruction of the cell by an outside, changes in the environment or by toxins or bacteria and so on, or by your immune cells. But in apoptosis, the role is normal death of a cell. It's programmed death of a cell. Cell gets old, it needs to be replaced by another cell. So the old cell dies and then new cells are created. So this is showing you pycnosis, karyorrhexis, and then you have karyolysis. You can see in karyolysis, the whole nucleus just disappears. Now, what happens in reversal? Yep.
So is pycnosis the shrinking of the nucleus?
Actually, yeah, these are all nuclear events. The whole cell shrinks.
So would it be like this, the cell itself swells, but the nucleus is being degraded, so it shrinks?
They both shrink, but cell shrinks more than the nucleus. So it does appear bigger,
Okay.
but the cell also shrinks in pycnosis.
Okay.
Let me just clarify this. Because you have pycnotic cells and then you have pycnotic nuclei. I think the ratio changes. The nucleus to cell ratio changes. So the cell, although both are shrinking, the nucleus shrinks slower than the cell, and so it appears bigger, something like that. But it is shrinkage basically.
Okay.
All right, now in reversible cell injury, you have ATP depletion, which is understandable, right? Why is there ATP depletion? Because there is reduced oxidative phosphorylation, which is decreased formation of ATP, and there can be cellular swelling. Now, if it's apoptosis, the cell is not injured, cell is just dying because it's programmed to die. So you won't see these changes in apoptosis. This is only when the cell gets injured by an abnormal, environment. So it could be toxins, it could be anything. So usually in cellular injury, you see a swelling of the cell. Now in irreversible cell injury, where the cell will eventually die, you see mitochondrial irreversibility, which means that now, even if you restore oxygen and you make the environment suitable, the mitochondria is now damaged beyond repair. And so it becomes irreversibly damaged, and there is permanent dysfunction of the mitochondria. You will also see irreversible membrane defect, the cell membrane. It will become permeable. cytosolic contents will start leaking out, organelles may leak out, and now there's no recovery from that. And then lysosomal digestion. The lysosomes may rupture, and all the enzymes of the lysosome, they will start degrading the cells. Now, causes of injury to cells. You have hypoxia, which is the number one reason for cellular injury. Then you have physical agents, you have chemical agents, you have infections, which are also very, very common. Most of them will lead to hypoxia. So, other than that, you have immunologic reasons. Again, your immune cells can start attacking your host cells by not recognizing them as your host cells. You can have genetic problems that can lead to cell death. Nutrition. So improper nutrition can also lead to cell death. But the most common are physical agents, chemical agents, infections, and hypoxia. So again, when you talk about reversible injury, there will be decreased ATP, there will be mitochondrial damage, calcium will start accumulating because the pumps are failing now, more free radical formation, and then cell membrane permeability will change. This is light microscopy of an injured cell. On the left you have an injured cell, on the right you have a dead cell. So you can see all this carrier excess on the right side, where you can see lots of dark spots, which are all fragments of DNA. On the left, you see a mixture of pycnosis and carrier excess, where you see some fragments, but the cell is still not dead. So if you see on light microscopy, if you see a lot of dark spots, so that would show you that there is a lot of carrier excess, and that probably means that the cell is almost dead. Now, different types of necrosis. Now, all cells, they don't die in the same way. So when they die, you have different types of necrosis. In the brain, most of the necrosis that occurs is called liquefactive necrosis. Because of the way brain cells are, they release a lot of fluid when they die. Their cell membranes, they rupture, they become permeable, and they release a lot of fluid, and so it's called liquefactive necrosis. You can see liquefactive necrosis in other parts also, but mostly common to the brain. Then you have gangrenous necrosis or gangrene. It usually occurs in the extremities. Gangrene also occurs in your bowel, so in your small intestine. It can become gangrenous. It could also be non-specific in other parts of the body. Gangrene can be wet gangrene, or it could be dry gangrene. Have you seen patients with gangrene? It's all black, and sometimes it has cheesy material stuff coming out of it, so that's mostly wet necrosis. If it's dry, it will just be black. Then you have fibrinoid necrosis. That's mostly necrosis in the cartilage, in the bone. So it's mostly related to your rheumatoid arthritis. Then you have caseous necrosis, which is cheese-like necrosis, mostly seen in the lungs, and it's usually a hallmark of tuberculosis. It leads to cheese-like formation, and when you take a section of the lung, you can actually see these spots, cheese-like spots. Then you have fat necrosis. Any fatty tissue can have fat necrosis, most common in the breast. And then you have avascular necrosis, or is also known as ischemic necrosis. Now, avascular necrosis, as the name indicates, it's disruption of a of the blood supply to an organ. And disruption of blood supply to an organ can lead to avascular necrosis. What's the most common place of avascular necrosis? Hip joint. Your hip joint. There's only one vessel going from your acetabulum into the neck of the femur. So if your hip joint gets dislocated or there's a fracture to the neck of the femur, this blood vessel gets damaged. And so you get avascular necrosis of the neck of the femur. Other than that, you can disrupt blood supply to an organ by radiation. Kidneys, certain drugs can cause avascular necrosis of the kidneys, especially in the papillar area of the kidneys. Some example, this is liquefactive necrosis. So you see a lot of inflammation, all the lighter areas, it shows you increased amounts of fluid and glial cells. This is another picture of an X-ray of a liquefactive necrosis of the brain. So you can see the frontal lobes, how they are full of fluid. Yep.
Does the necrosis of like some parts of whatever organ lead to necrosis in other?
Yes, it does. This is caseous necrosis. This is a lung with advanced necrosis. This is tuberculous lung. So you can see all these spots everywhere. This is the bigger area, but it's almost everywhere you can see these cheesy spots. This is fibrinoid necrosis. All the pink area, this is fibrin. So when you see a lot of fibrin, this is associated with fibrinoid necrosis. So usually will be seen in cartilage, bone, and so on. This is your wet versus dry ganglion. Now gangrenes, it's not like they follow a certain path. A gangrene can be, wet gangrene, and then it turns into a dry gangrene. Or it could start off as a dry gangrene, turning into a wet gangrene. So it's like a spectrum. This is avascular necrosis of the hip. So you can see these arrows, the necrotic parts. And that leads to fracture of the hip joint. And so once you have injury to the hip joint and there's avascular necrosis, the only solution is hip joint replacement. So here you can see what happens when there's hypoxia to a cell, how free radicals are formed, and then what happens when you reperfuse a cell. So reperfusion, sometimes if you do it fast, that can actually lead to more formation of free radicals. So when you're reperfusing an organ, make sure that it's always a slow reperfusion. If you reperfuse an organ very quickly, you can lead to formation of more free radicals, which will actually cause more damage. So you can have, radiation, toxins, or sudden reperfusion of a hypoxic organ. What will that do to the mitochondria? It results in production of these ROS, or reactive oxygen species. Now you can have oxygen superoxide, you can have hydrogen peroxide, or you can have hydroxyl, OH radical. Other than that, you can have nitric oxide, which also acts like a free radical, and they all damage the cells. Now, these free radicals are neutralized by your body. So superoxide is converted into H2O2, then you have hydrogen peroxide, which is turned into water by glutathione peroxidase and so on. So your body has mechanisms to convert these free radicals into more safer substances. But when they are produced in a greater amount, then the body is unable to convert them. So what happens by these free radicals? You can have lipid peroxidation, which causes membrane damage. You can have protein modifications that lead to misfolding or breakdown of proteins. And then you can have DNA damage, which can cause mutations and cell death. So this explains what free radicals are and how they damage your cells. Now, some examples of chemical injuries. So there can be numerous chemicals that can cause injury, mostly drugs. Endogenous substances like CCL4, which is your chemokine ligand 4, it basically attracts all the immune cells, which will cause injury to the cells. Drugs, you have an example of Tylenol, but a lot of drugs cause cell injury. So, and they are mostly related to dosage of drugs. So if you take unsafe doses of drugs, it can cause cell injury. So these are all examples of chemical injury. All free radicals are examples of chemical injury. So your nitric oxide, your reactive oxygen species, all of them can cause damage to the cells. Nitric oxide is also produced by your macrophages and lymphocytes. Remember, it's a natural part of, natural function of your macrophages and lymphocytes. And why are they produced? Any idea? To kill offending agents, right? One of their functions is to, the lymphocytes and macrophages, their job is to kill bacteria and toxins. So how it does that is by producing these nitric oxide free radicals to damage those cells. Again, different kind of injury. So you can have hypoxia, ischemia, radiation, causing mitochondrial damage, which decreases ATP production, increases free radicals, which causes necrosis of the cells. You have free radicals, how they damage the cell membranes, how they can damage the protein, DNA, and how they can damage other protein formation, and so can lead to necrosis. And then the third consequence of cell injury is apoptosis. So sometimes certain processes can damage the DNA, and they can result in activation of all this process that starts apoptosis. So outcome of cell damage could be necrosis or could be apoptosis. We're almost done, so a few more minutes. Yes?
So the nitric oxide is like a byproduct of phagocytosis?
Byproduct of?
Like, it's produced by the macrophages and lymphocytes?
And also, it's a free radical. Anything with oxygen. So what happens is, some cells will produce nitric oxide to kill other cells, which is your immune cells, right? Which is your macrophages, lymphocytes. They will produce certain enzymes, they will produce certain, free radicals to kill other cells, right? Unwanted cells. But these free radicals are also produced by your mitochondria when the cell has like a, deficiency of oxygen, or when there is other damage to the mitochondria by radiation or by other mechanisms. It can decrease ATP production and increase these free radical production. And
Okay.
then these free radicals, if they are not neutralized by the cell, they cause damage to the cell. Again, it's showing you what happens to mitochondria when it becomes ischemic. So you have failure of the sodium pump, sodium-potassium pump, you have failure of the calcium pump. And so potassium moves out, sodium moves in, calcium moves in, and just destroys the cell. The cell, because of hypoxia, because of decreased ATP, cell starts another process of producing energy, which is called anaerobic glycolysis, right? What is aerobic oxidation? Basically, you need oxygen to produce ATP, right? Which is oxidative phosphorylation. But when oxygen is not present, the cell goes into anaerobic respiration, or it starts producing energy by breaking down glycogen. That's the second mechanism for producing energy. It's an emergency mechanism, but it leads to formation of lots of lactic acid, and that leads to decreased pH of the cell. So different things happen when there is hypoxia to the cell. The cell, the whole homeostasis of the cell is disturbed, all the pumps will fail. The cell goes into, anaerobic glycolysis, so the pH changes, and you have ribosomes which get disrupted from the endoplasmic reticulum, and so protein production goes down. Now, a few words about apoptosis. It's normal programmed death of a cell. Sometimes it could be because of injury. Injury leads to activation of apoptotic processes that leads to apoptosis, where it can be called necrosis. So some examples of apoptosis would include, the most important reason for apoptosis is aging of the cell. The cell becomes old, it has accumulations, it's not performing well, and so it needs to die. And it gets replaced by a new cell which doesn't have accumulations, and it works well. So cell replication, old cells, they have DNA mutations, old cells have decreased replication, which is why they need to be removed. More examples of apoptosis: embryogenesis, disappearance of embryonic cells once the fetus is formed. This is also because of apoptosis. Hormonal involution. If hormone production goes down, all the organs of the body that were stimulated by this hormone will now not get stimulated, and so these organs will regress because of apoptosis. So hormonal involution is important, especially during menopause, old age, testosterone production goes down in males, and so all the organs which were responsive to these hormones, they will stop responding now, and they will shrink, and they will become apoptotic. And then just to control cell population, an example of crypt cells of the intestines. Remember the crypts in the intestines? Their cells, they are programmed to die just to control their population. Post-inflammatory cleanup. This is also, there's a lot of apoptosis going on here. Elimination of harmful cells. Cytotoxic T cells cleaning up, after some, infection or something. So this is all part of examples of apoptosis. And then pathological apoptosis. Now, we use two words, necrosis and pathological apoptosis. The difference is necrosis is just direct injury to the cell and death of the cell. Pathological apoptosis is some pathology triggered apoptotic process. And so the cell dies through apoptosis, but it's because of a pathological process. So little difference between pathological apoptosis and necrosis. So examples of pathological apoptosis would include toxic effect on cells like chemicals, viruses, bacteria, and so on. Pancreatic duct obstruction. This leads to apoptosis of the acinar cells. People who have pancreatic duct obstruction, you see that the acinar cells, what do acinar cells do in the pancreas? They produce pancreatic secretions, right? The enzymes and the fluid, right? So the acinar cells, because there's obstruction of the duct, the pancreatic secretions cannot move out. So pancreatic fluid stops getting produced, and the acinar cells, they undergo apoptosis. So there's a pathology, and this pathology causes apoptosis of cells. Tumor cells are another example of pathologic apoptosis. So the whole thing, apoptosis, pathological apoptosis, and necrosis, it's like a spectrum. You can't really differentiate completely between the three. There's always some overlap between apoptosis and necrosis and pathological apoptosis, because there's always some malfunction going on in the body, and then it causes either necrosis or pathological apoptosis or just regular apoptosis of cells. So it's like a spectrum. You cannot really separate one from the other. And then we talked about what happens in apoptosis. It follows the three steps. You have pycnosis, you have karyorrhexis, and then you have karyolysis. Again, you see more of these in necrosis and less in apoptosis. But again, it's a spectrum, so you will see these changes. The cell membrane, it forms little blebs on them, and then the organelles may be thrown out of the cell by converting into apoptotic bodies. And those will be then phagocytosed by your immune cells. So this is showing you pycnosis and karyorrhexis. And then what happens in apoptosis, there's digestion of proteins by capsases, DNA breakdown by nucleases, and then phagocytic recognition. So the cells, they lose their self-antigens, and they are recognized by phagocytic cells as dying cells, so they can phagocytose them. And then you talk about subcellular responses. Of course, lysosomes become active, and they start digesting everything within the cells. Membrane folding becomes disrupted. Irregular folding of proteins will result in endoplasmic reticulum stress and so on. There will be mitochondrial swelling and then all kinds of changes. Cytoskeleton can be disrupted, so the thin actin myosin filaments, which basically are part of your cell membrane, will also become disrupted, so the cell will not be able to function properly. You see all kinds of intermediate filaments like keratin, desmin, and so on. Now, misfolded proteins cause all kinds of diseases. And some of these diseases are mentioned here. So it tells you about the disease. It talks about affected protein and the pathogenesis of the disease. One of the most important misfolding protein disease is called cystic fibrosis. Heard about this disease? So the affected protein is called CFTR protein, or cystic fibrotic transmembrane conductance regulator. This protein is not folded properly, so it's a protein misfolding disease. And there is, what happens in cystic fibrosis? Chloride conductance is affected. Then you have familial hypercholesterolemia. So which protein is misfolded here? The protein for LDL receptor. So LDL receptors are not formed. What happens when LDL receptors are not formed? LDL cannot be removed from the blood. So it leads to hypercholesterolemia, which is called familial hypercholesterolemia. You have Tay-Sachs disease. So it's another disease. It's because of the affected protein is hexosaminidase alpha. So it's a storage disease. Lysosomal enzymes are not stored properly. Then you have retinitis pigmentosa. In this disease, rhodopsin is not produced. Remember rhodopsin? So rhodopsin is not produced, and that leads to blindness. You have Creutzfeldt-Jakob disease. So these are the affected proteins are prions. Prions are just unfolded proteins. So many proteins, they are not folded properly. Also leads to cell death. You have Alzheimer's. So what protein is not folded properly? A beta amyloid protein. So there's accumulation of this unfolded protein within the brain cells. And so the brain cells will start dying. You have alpha-1 antitrypsin deficiency. The protein which is not folded properly is alpha-1 antitrypsin. So it's a long list of diseases where proteins are misfolded, and so there's deficiency of proteins and the cells don't function properly. And it causes all kinds of diseases. These are some of the important ones. Familiarize yourself with these names because these are some common misfolding protein diseases, protein misfolding diseases. Okay, we really need to finish this. We have to do inflammation also, which is another, I don't know, 100 slides. So a few words about cellular adaptations. Do you know what hyperplasia is?
Is it like overgrowth?
Production of normal cells, right? So when a when an organ starts to produce lots of cells which are functional, which are normal, it's called hyperplasia. What is aplasia? It's the opposite. What is normoplasia? Normal functional cells of a organ. What is dysplasia? What is metaplasia? Metaplasia is when one functional cells are replaced by another type of functional cells. So what would be the example of a metaplasia? Your esophagus and stomach, right? So columnar cells in the stomach and squamous cells in the esophagus. Cervix is another example. You have squamous cells in the cervix, and then towards the uterus you have columnar cells. So this is metaplasia. Metaplasia is absolutely normal. One type of cell replaced by another type of cell. What is dysplasia? Dysplasia is when one type of cells are replaced by abnormal cells. What's the problem with, what's the danger of dysplasia? Dysplasia is the first step towards cancers. So your normal cells, for example, you have Barrett's esophagus, right? Where columnar cells starts to appear in the esophagus. And then these columnar cells are slowly replaced by dysplastic cells. And then that leads to esophageal cancer. Similarly in the cervix, your normal squamous cells, they are not replaced by at the squamocolumnar junction, they are not replaced by columnar cells, but they are replaced by abnormal cells, which are dysplastic. And that leads to dysplasias. What is anaplasia? Anaplasia is frank production of abnormal cells, which are difficult to control. And anaplasia is when a person has cancer.
Sorry, what's the difference between anaplasia and dysplasia?
Dysplasia is when a set of normal cells are replaced by abnormal cells. But these abnormal cells, they are not growing randomly. You just see them, but they are still under control. Their population is still under control. But anaplasia is when they start reproducing, proliferating without any control, and they are functionless cells.
Thank you.
So some showing you hypoplasia or aplasia, and then normoplasia and hyperplasia. So just more normal cells mean hyperplasia, less normal cells will mean aplasia, and normal production of cells in an organ is normoplasia. We don't use the term normoplasia anymore. Yes?
Would the hyperplasia be a benign tumor then?
No, hyperplasia is just a regular growth of cells, but in excessive numbers. So just a growth of an organ is hyperplasia. But could a benign tumor be hyperplastic? It could. You could have a tumor, a benign tumor, that may function normally. So it could be hyperplastic, but it could be just, dysplastic, not dysplasic. Could be just another type of cells which are not functioning, but not abnormal cells. Yep.
Would Barrett's esophagus be an example of metaplastic or dysplastic?
Dysplastic. Metaplasia leading to dysplasia.
Okay.
Yep. So metaplasia is when normal type of tissue is replaced by another. So you have a squamocolumnar junction both in the esophagus and in the cervix. So you have good example of metaplasia there. And then fibrous bone and regular bone is also different type of cells, which is also an example of metaplasia. Then, are you familiar with the terms hypertrophy, atrophy, and so on? Hypertrophy is increase in the size of the cell. So this is different from hyperplasia. Hyperplasia is increase in the number of cells. Hypertrophy is increase in the size of the cells. Like when you exercise and your muscles grow, you're just increasing the size of the cells. So there's hypertrophy. Like your heart, if you increase the after load, what happens? The heart cells become hypertrophied. So they become larger in size. What is atrophy? Atrophy is when they shrink in size. So the term hypertrophy is not used anymore, which should be the correct word, right? Hypertrophy and hypotrophy. But instead you use the term atrophy. Why do you have atrophy of cells, of an organ? The main cause would be denervation of an organ. For example, your muscle. If you cut the nerve supply of a muscle, the muscle stops working and it atrophies. It's not used anymore. So reduced workload, denervation, reduced blood flow, decreased nutrition, aging, and pressure. These are all conditions that lead to atrophy. And finally, we talk about intracellular accumulations. Lipid can accumulate, hyaline can accumulate, glycogen can accumulate, pigments can accumulate, calcium can accumulate. And then they all lead to, certain events. So you can have a fatty liver, pigment in the skin, and so on. This is a picture of a fatty liver. This is cholesterol accumulation in a plaque, in a blood vessel. So this is showing you normal part of a blood vessel. This is showing you all the cholesterol deposition. Is it too cold or is it me?
It is too cold.
It's freezing.
It is.
And they lock those thermostats, so can't even change the setting. They want us to freeze. And then you have pigments. You can have endogenous pigments, which is hemosiderin, melanin, and so on. And then you can have exogenous pigments like tattoos, anthracosis. What is anthracosis? Anthracosis is carbon deposition. Where do you see anthracosis? In the lungs, smoker's lungs. And they're beautiful. I'll show you a picture. This is anthracosis of the lungs. So if someone smokes for 10 to 20 years, this is what the lungs will look like. This is endogenous pigments, hemosiderin, melanin, etc. They all appear golden brown. And then calcium deposition will lead to calcification. So your blood vessels have calcium deposition, so calcification of the blood vessels. Hyperparathyroidism can lead to calcium deposition in cells. Metastatic disease can lead to calcium deposition. And that's it. Take another 5-minute break, and then we start off with information.